Hospital Home is a service we are now developing in Western Sydney and pretty much all around New South Wales Health, where we can provide care for the patient at home, similar to the standards that we would expect at an hospital. We've also realized a lot of healthcare actually happens at home. The ongoing recovery happens at home. And that critical phase before people come to hospital and after they go home after hospital is where, if we can do things better, we can actually make sure that these patients don't end up back in the sick state. The whole concept of better value care comes from the point that it is centered towards the patient and the patient's needs. So sometimes we are treating the problems that the patients are facing, and in hospitals we're trying to treat a condition. But hospital in the home and better value care is about treating the whole person and supporting them beyond just the needs for their illness. What we are trying to develop is this alternate care model which people can trust and have access to, at least during the pilot phase, during working hours, so then we can keep these patients more at home longer and safer. Hospital-based care carries its risk of certain infections you can catch in the hospital. More and more we are finding internationally, people are looking towards alternate models of care which can prevent people from coming into a hospital. And for the system, then it means that it's a better and more efficient and effective use of hospital services to the really sick people who are waiting in our emergency departments and the hospitals to be seen by doctors and nursing services. And we are clearly bursting at our seams providing that care. I'm hoping that the ambulance services see value in this because it helps their own clinical skills. And I think with the great trust that people have in the ambulance service and the great response times they have, we can work in partnership with them to identify the right patients for a service who can stay at home. They're really good at picking up patients who can't stay at home and have to come to hospital immediately. And I think by providing them that power to tell the patient, look, someone's coming to look after you even after we've gone, gives them that additional support that a lot of these patients need to stay at home, and also relieve the anxiety that they've been taken care of even at those critical phases of their health care.